I'm Rachel Batterham, and I've spent the last 2 decades treating people living with obesity. Many of my patients have never been asked about obesity by their general physician or other healthcare professionals. And this is in part because other healthcare professionals find raising the topic of obesity difficult, or they don't know how to do it. So I'm going to give you an easy guide of how to do this based on the Canadian Clinical Practice Guidelines, so using the 5A approach. Now, the most important A is to ask permission to discuss weight with a patient. Next is assess, where we need to be assessing the causes of obesity in that person and also the impact of obesity on their health. The third A is to advise, based on the health risks that the person might have, and to discuss the various treatment options. The fourth A is to agree, and this needs to be a partnership together with the patient to agree realistic goals. And the fifth A is to assist them. There is no point just asking somebody to go off and lose weight without giving them access to evidence-based resources and also holistic treatment. These 5 A's don't have to be undertaken in the same consultation. We can do this over time. I'm just going to go into these in a little bit more detail. But before I do that, I want to really emphasize the importance of using person-first language or people-first language. We need to say a person with obesity, a lady with obesity. We mustn't use the word obese. In the same way that we wouldn't call somebody cancerous, we mustn't use the word obese. We have to replace this in everything that we do. Now, let's come back to asking permission. How do we do this? Well, we can do this very simply by saying, like, I notice you're carrying a bit of extra weight. Would it be okay if we discuss this with you? Would it be okay if we talk about your weight? You can also ask, are you worried about your weight? Or pose it in the form of a health benefit by saying that losing weight has many health benefits. Would you like to hear about the options available to help people lose weight? If the person says no, then open the door for the next time. Ask them, would it be okay if we ask you again in the future? Or maybe let me know when the time is right for you to discuss this. So the next A is to assess. So this is to assess the drivers and causes of weight gain in that individual. If you ask a person when they've gained weight or the reasons behind, they will usually be able to tell you. But it's also important to look at things like medications. Are they taking drugs that increase weight? For example, some atypical antipsychotics. Then assess the barriers to weight loss. Are they able to afford healthy food? Are they able to afford to go to the gym? Do they have issues with childcare? Then next, it's really important to assess the severity of obesity, calculate their body mass index, and look at other anthropometric assessments, for example, measuring their waist circumference, waist to height, use BIA, or DEXA, depending what is available. But it's really important to see if fat is distributed within the abdomen, which is where it's associated with increased cardiometabolic risk. And then assess for other obesity-related complications. And we know that obesity can lead to over 200 complications, impacting on every single organ system in the body. And it's important that we look at these in people affected by obesity and treat these accordingly. And in terms of scoring systems, we know that BMI itself is not a great predictor of impact of dying. What we can use is staging systems such as the Edmonton Obesity Staging System. And if we use this, it identifies people who are at most risk of dying and in whom we need to be slightly more aggressive when we're talking about therapy. So the Edmonton Obesity Staging System looks at 3 components: medical, psychological, and functional, and then is divided into stage 0, 1, 2, 3, or 4. The next A is to advise. We need to advise the person on the health risks of their excess weight, but more importantly, on the health benefits of weight loss. We need to discuss the options available to that person to help with weight loss. And these will depend on their age, gender, BMI, and other obesity-related complications. We need to share resources and educational materials so that they have those to take home to their loved ones and to have when they've left the consultation. And we need to arrange a follow-up appointment to ensure that they understand what they've been advised. Then you need to agree on the next steps and the treatment plan. And these goals need to be focused on health gain and not just reduction in the amount of weight. And really need to be a partnership here between the healthcare professional and the person living with obesity, so you really agree on what you're trying to achieve. The final A, and which is also the A that healthcare professionals do the least, is to really assist a person with managing their weight. So we need to assist with solutions for the drivers for obesity, so removing or changing medications, and also see if we can help with the barriers so that they can shape their environment to help them to lose weight. And we need to do this through providing education. We also need to assist with an appropriate treatment plan, and also not forget to signpost them to patient support groups. And then in terms of thinking about the treatment plan, this is usually based on clinical practice guidelines within each country. These vary, but always have lifestyle as the cornerstone, and then add in different interventions such as pharmacotherapy or metabolic bariatric surgery, dependent on the BMI and also the complications that the person might have. This 5A approach really does offer a comprehensive guide to how we manage people with obesity to improve their health.